Hi, how's it going?
Good.
My name's Tom Brady. I will be your physical therapist assistant student today. What was your name?
Esmeralda.
Esmeralda, what's your last name?
It's Brown.
Esmeralda Brown.
Sorry, I forgot it for a second.
Awesome. No worries. And what are you in for today?
I'm having some back pain,
Okay.
actually.
And can I get your birth date real quick? I just want to make sure I got the right person.
It's January 1st of '89.
Perfect, yep. Okay, and lower back pain you said, right? I got the right person. What exactly were you doing to cause that lower back pain? Do you know?
I've been moving a lot of stuff in and out of houses lately, so I'm not sure if something happened when I was moving boxes or.
Maybe just a lot of repetition.
Mhm.
Okay. Is that when you first noticed that lower back pain?
I've noticed it for a while, but that's when it started getting really sharp.
Worse. Okay. And how long has that been going on for?
The sharpness, a month now?
About a month.
Mhm.
Okay. It's just that sharp pain. That's how you describe it.
Yeah.
Okay. Just kind of at rest on a scale of 1 to 10. 10 being some of the worst pain you've ever felt, 1 being the least. What would you rate your pain as right now?
Right now, just sitting here like a 2.
Just a 2, so it's not too bad. And when you're lifting, how during active times, how high on that scale would you say it gets?
Sometimes a 6. It can be up to like an 8 maybe.
Okay, gotcha. So it does get pretty high up there
Mhm.
sometimes. Now, where exactly in your lower back did you say it is?
Just
you be able to
right
show
in
me?
the middle there.
Okay, just
Yep.
right in the middle of the low back?
Mhm.
Awesome, okay. Well, what we're gonna work on today is just being able to teach you some techniques to be able to hopefully alleviate that pain. Maybe teach you some things you may be doing wrong during lifting, and to just relieve some pressure off of that lower back. So would you be able to stand up with me today? Is it okay? Do I have your consent to treat you today?
Yeah, that's okay.
Perfect. Okay. So we wanted to teach you a few techniques that you'll be able to use during lifting that are going to be able to help you maintain your center of gravity and relieve that pressure off your lower spine, like I said. And then we'll teach you, especially, we're going to go over reaching today. What we wanted to go over first is what we call diaphragmatic breathing. You'll want to be using this technique anytime that you're lifting. Diaphragmatic breathing just has to do with breathing using your stomach and your diaphragm to breathe. So if you could just place one of your hands right over your stomach, just below your rib cage. You're going to breathe in through your nose and you're going to breathe out through your mouth. And we breathe in just like smelling the roses. And then when we breathe out, it'd just be like blowing out our candles on a birthday cake, okay? When we breathe in through our nose, I want you to push your hand out with your stomach. So it's just pushing that hand out as I breathe in through my nose. And when I breathe out, my stomach should be coming right back in, okay? Good. Is it coming in and out?
Yeah.
Perfect. So we want to focus on that when we're breathing. The other thing that we wanted to focus on is being able to keep a neutral pelvis as we bend down to lift things. Do you feel these bony parts, the protrusions out of your hips?
Mhm.
Okay. If you can take those and just tilt them downward. It's going to kind of stick your butt out, bring your chest up. Basically, it's going to put that obtuse curve right here at your back. Okay, you feel that?
Mhm.
Okay. And what we don't want our back to be positioned in that manner in any sort of way. That's going to put a lot of tension on our back or our spine. Now, can you bring those points just up towards the ceiling? Okay, you're going to bring your back as like a C curve.
Mhm.
Okay, that's going to be the extreme on the other way. We just want to kind of keep it neutral. That's what we call a neutral pelvis. You should hopefully just be relatively relaxed and no pain right there. Okay, does that feel okay?
Yeah, feels good.
Last thing is we just want to focus on keeping that back straight. We're going to use a dowel. I'm just going to place this dowel over my back. I'm going to keep my lower hand just right over my lower back. As we bend, my knees shouldn't cross over my toes, and then this lower hand shouldn't leave my lower back. So bend down, and then up. Can you give that a try for
Yeah,
me?
I can do it. Let's see.
Perfect. And how does that feel?
Yeah, it felt pretty good.
That's good. All right. Well, let's just move to the last part here. You seem to got those down pretty good. We're going to go to reaching. Me, I always tend not to reach something smaller. You're a little tall. We're gonna go for this right up here. But I'll just give you a demonstration really quickly. When reaching, we always want to bring our center of gravity close to the object that we're reaching for. So I'm going to use a stool. I'm going to get my center of gravity up as close to the object that I'm trying to reach. I'm going to bring that object as close to my center of gravity as possible. I'm going to step right back down. No twisting. I don't want to reach outside of my center of gravity because otherwise that could cause me pain. Okay, I'll step right back up, put it right back up here. Have you do that for me?
Okay, yeah.
So we'll just have you grab this, that prosthetic up there.
The foot?
That model, that foot model. Perfect.
Okay. Right, so step up.
Mm-hmm. You're gonna reach up straight. Bring it close to your center of gravity and step right back down. Perfect. Now can you put it back up there for me?
Yeah.
And then just step back down. Sweet. Do you have any questions for me, Esmeralda?
I do not think so.
You did great. Here is a little pamphlet just for your information if you have any questions.
Okay, cool.
Okay.
Alright, thank
Thank
you.
you. Have a great day.
You too.